Hey guys, my name's Joel and I'll be talking to you today about iron considerations for adult female athletes. So, what is iron? Well, iron's an essential trace mineral important for many physiological processes, and it must be found in the diet because us humans, we have no mechanisms for generating our own iron supply. Now, the main reason we need iron is that it acts as the functional component of hemoglobin and myoglobin, which bind to and transport oxygen in the red blood cells and muscles respectively. This oxygen is then delivered to the mitochondria, where it is required for aerobic respiration and energy production. Now, iron also plays a role in various neural, immune, and cognitive functions. However, despite iron's biological importance, some individuals are at risk of depleting their iron levels, varying from minor depletion to severe iron deficient anemia, where actual hemoglobin production can fall. So to highlight how important iron is for erythropoiesis, or red blood cell production, we can refer to a case study by Garvacan et al. In 2011, where they treated an iron-deficient anemic female distance runner with iron supplementation for 15 weeks and found that total hemoglobin mass increased by a massive 77%, which is a huge increase in oxygen carrying capacity. And in fact, research from Gardner et al. In 1977 found that even small decreases in hemoglobin, so just 1 to 2 grams per 100 ml, can decrease performance by around 20%. And then in addition to these direct performance decrements, depleted iron levels can cause increased fatigue, impaired immunity, disturbances in brain and muscle metabolism. So not good things. Now, there are a number of groups that have an increased risk of iron depletion, and these include females, endurance athletes, and especially distance runners, and then those that follow a vegetarian or vegan diet. Studies by Risser et al. In 1988 and Malkowska in 2000 indicated that 26 to 31% of female athletes could be considered iron deficient. And in a 2005 paper titled Iron and the Athlete, Sudicum and Dimef presented a number of potential causes as to why iron deficiency may occur in these individuals. And these include factors such as poor dietary intake, menstrual losses, foot strike hemolysis, where basically as your feet collide while you're running, your red blood cells can get destroyed, gastrointestinal bleeding, and sweating. So some of these aforementioned causes, there's not a lot we can do about it, right? Endurance athletes, they can't really stop running, okay? But the dietary factors can be manipulated. So the RDA for adult females is about 18 milligrams per day, and the tolerable upper limit is 45 milligrams. However, the issue is that there's vast differences in absorption. So for example, we have heme iron, which is found in animal products like meat and fish. It's only about 10 to 15% of the total iron in the diet, but it's absorbed really well. On the flip side, we have non-heme iron. So this is going to be found in vegetables, whole grains, fortified foods. Makes up about 80% of the total iron, but it's absorbed really poorly. And to make things even more complicated, absorption can also be affected by other components of the diet. So if you consume iron-rich foods alongside vitamin C, vitamin A, and muscle meat, this can significantly increase how well it's absorbed. On the flip side, if you consume iron alongside phytates, polyphenols, and tannins, so in like tea and coffee, this can actually decrease absorption. And what this means is there can actually be almost a 10-fold difference in the iron absorbed across meals with similar iron content. The Clinical Sports Nutrition textbook indicates that athletes may need 1.3 to 1.7 times the daily iron intake of the general population, and vegetarians may need up to 1.8 times as much. And the final point, iron supplements can be effective, but they should be used on a case-by-case basis after consulting with a physician and after first trialing different dietary measures.